Welcome. Thank you for joining us, everyone. Hope you enjoy the music and the energy. We'll get started in a couple minutes. Okay, welcome, everyone. Thank you for joining us from the U.S. to Palestine and medical apartheid rally, conversation, and call to action. We're so thankful that you could join us here today. We're humbled by your participation. We see we have a large crowd. We'd like to let you know a little bit about the Invest in Justice Coalition that's come together to bring us together today. So the U.S. Campaign for Palestinian Rights, of which I'm representing. My name is Hassan Abusita, and I have the pleasure of serving as the executive director. We also have Adala Justice Project, Jewish Voice for Peace Action, Empower Change, Eyewitness Palestine, FOSNA, the DSA Working Group on Palestine, and PIPD. Thank you, everyone, for bringing us together for this conversation. Our goal is simple. We want to end U.S. complicity in Israeli human rights abuses, building on the Freedom is the Future vision and platform, and of course, the historic Palestinian letter to Congress from last fall. Since we launched this End Medical Apartheid campaign, nearly 20,000 of you have pushed Congress, and 26 members of Congress have spoken out against medical apartheid. We've seen our pressure work, thanks to you. Israel has been forced to provide the vaccines that they are obligated to provide under international law. First to Palestinian prisoners, then to over 100,000 Palestinian workers this month, and soon we demand to every Palestinian. During this call to action event, we'll hear from 5 powerful speakers based in Palestine, the UK, and the US, as well as a very special message from our very own Congresswoman Tlaib at the end. We'll learn together about the ways medical apartheid hurts people in the US and in Palestine, and we'll talk about ways to take action to call on Congress to end vaccine apartheid. You'll also hear more about the strategy behind our coalition's work and campaign. With that being said, let's get started. I also wanted to thank our co-sponsors who are on the slide that you can see right now. Perfect. Thank you to our co-sponsors. We are appreciative of all of our movement partners for their investment in this work. We couldn't have done it without you. We're going to encourage folks to, throughout the program, leave your messages in the chat. If you have any questions or things you'd like for folks to touch on, please leave those in the chat throughout the event. Our chat moderators will respond and use the Zoom reactions. If something a speaker says feels resonant with you, we'll make sure to lift that up. Thank you very much again for joining us. With that being said, I'm going to go ahead and introduce our first speaker. Our first speaker is Dr. Hassan Abusita. He's an honorary senior lecturer at the Center for Blast Injury Studies at Imperial College London University. He's a British Palestinian plastic and reconstructive surgeon who has published extensively on war injuries. He has worked as a war surgeon in Iraq, South Lebanon, and during the 3 wars in the Gaza Strip. Dr. Hassan, thank you for joining us. The floor is yours.
Thank you very much for inviting me, and thank you very much for your kindness. The aim of this quick talk is really to try to place the pandemic and what has happened in Palestine in a historical perspective, and really to try to understand what the pandemic has taught us globally and why it is important for us to understand what's happening in Palestine, not only for Palestine, but actually for the global struggle for justice. This pandemic has acted as a stressor, which has delineated power structures across the globe. It has shown up areas of injustice and power gradients across the whole of the globe, from Palestine to South America to the issues surrounding migrant workers. And in Palestine, this stressor, or what Foucault described epidemics as doing, as speaking the truth of the system, has shown that settler colonialism functions in a way that is structured, and therefore the structural oppression of settler colonialism dealt with the pandemic as it deals with all aspects of Palestinian life. And I will start from the end. Why is it important for us to understand what's happening in Palestine in order to see what's going to happen in the rest of the world? Well, it is obvious that in Palestine, particularly in Gaza, but also in the West Bank, Israeli capital has now occupied a position where it views the Palestinian population as a laboratory for the security military industry, which it then markets globally as a solution to managing surplus populations and to managing intrinsically unruly communities. And so what we saw from the beginning of the pandemic is that that industry had quickly remarketed its security products, its surveillance products, the IT surveillance industry that basically prides itself on the fact that it is, as one of the CEOs said, only 10 minutes away from its laboratory, immediately rebranded a lot of its products, its facial recognition products, its voice recognition products, its mass surveillance products, rebranded them as products for biosecurity, as ways of monitoring and policing mass populations. And this was seen in an increase in the sales of these products to the Indian police, to the South Korean police, to lots of police forces around the globe. On the other side, we want to see how the pandemic spoke truth of the system of settler colonialism in Palestine and the apartheid system, which is now a kind of transitional part of that settler colonialism. Palestinians, the Israeli settler colonialism attempted to basically weaponize the pandemic and use it further against the Palestinian population, first to disempower them, and two, to exert pressure in order to extract political concessions from them, and then, and most importantly, what Israeli policies have always aimed to do, which is convert the question of Palestine from a political question to a humanitarian crisis. And so through the generation of humanitarian crises, we are able to see the conversation around Gaza no longer being raised in terms of the right of return of Palestinian refugees that make up 85% of Gaza's population, or the siege as a form of warfare, or the denial of Palestinian political rights and the right to self-determination. But we see Gaza as in terms of water and sewage and electricity and access to healthcare and access to medication. And so that creation of crises or creation of catastrophe was continued to be used by the Israelis during the pandemic. So initially, Israel denied Palestinians access to PCR tests. And so in Gaza, for the first 5 months of the pandemic, the authorities there had to rely on basically medieval methods of controlling the pandemic, which is to put people in quarantine for over a month when they arrived to Gaza, to make sure that they did not have the infection, because they had no access to PCR in any meaningful numbers. The only time Israel allowed the World Health Organization to allow PCR tests was with the proviso that sewage effluent going into the sea in Gaza would be tested for COVID, to ensure that any of the COVID in the effluent does not reach Israeli beaches. At the second stage, when the vaccine became available, the Israeli authorities first denied that they had any duty to provide vaccinations to the Palestinians. And then when vaccinations were provided by the international community in the form of the Sputnik vaccine that was sent by the Russian authorities to the PA, they actually intercepted the vaccine and prevented it getting to Gaza.
That's right. That's right.
The only time, yep.
Dr. Ghassan, sorry to interrupt.
Yeah.
I think it's incredibly important that you brought up Gaza. I just wanted to make sure we were redirecting to our other speakers in a timely fashion. Is it okay if we go ahead and start transitioning? You want to maybe wrap up a few thoughts?
Yeah. So I'll wrap up. So the only reason the Palestinian laborers working inside the Green Line received the vaccine was because the Israeli epidemiologists and the public health experts informed the government that it was useless to vaccinate everybody, with the exception of 100,000 who would enter. And so Palestinian lives only matter in as much as they matter to the lives of the settlers in the racial colony. And therefore, that is the only mass vaccinations that the Israelis have done. Palestinians remain denied vaccines, both in the West Bank and Gaza, in any meaningful numbers. And the deaths in the third wave of COVID that started in the West Bank and is about to start in Gaza will continue to mount. Thank you very much. I hope I haven't taken too much of your time.
Thank you very much, Dr. We appreciate it, and especially the spotlight that you just put on Gaza. And of course, before we transition, I just want to mention the Great Return March that we are 3 years now from the beginning of. So shout out to Gaza in solidarity always. Next up, we'll be introducing Manal Shqeir. Manal is the International Outreach Coordinator of the Land Defense Coalition, an umbrella of grassroots organizations based in Palestine. She's a trade unionist in the Palestinian New Federation of Trade Unions. One time for union power. Manal, the floor is yours.
Thank you very much, Ahmed. Thank you for inviting me and for organizing this really important panel discussion about medical apartheid, and specifically to talk about the situation of the healthcare situation of Palestinian workers, because the spread of the pandemic has ran down paths of inequalities that were there before the spread of the pandemic in terms of Palestinian workers' access to healthcare. Before I talk about the situation of Palestinian workers at Israeli situation in terms of access to healthcare, I want to just explain to you how the healthcare system for Palestinians working at Israeli corporations, either inside settlements or inside Israel, work. Palestinians are classified according to Israeli permit system into legal workers and illegal workers. So legal workers are also have two classifications. The legal workers are those who have work permit to work inside Israel, and they are about 60,000 workers. And another, the other type of legal workers are those who have permits to enter settlements. They don't have work permits, they have entry permits to Israeli settlements. And then the rest are illegal workers. They are denied permits by the Israelis, so they smuggle illegally. To start with the legal workers, they have health insurance at Israeli corporations, mainly inside Israel. They have health insurance, and they pay about $28 a month for that. But the Israeli government refuses to treat them at Israeli health centers. Instead, they coordinate with the Palestinian Ministry of Health. So any Palestinian workers who get injured at the workplace at Israeli corporations or get sick, they are transported or transferred to Palestinian hospitals. And we know that Palestinian hospitals in the West Bank are not really serving the Palestinian people as they should do because of the Israeli strangulation of the Palestinian economy. Regarding the legally classified workers who have entry permit inside Israeli settlement, these workers are denied a health insurance because they have a permit to enter the settlements, but they don't have a work permit. So most of the Israeli employers, they deny them health insurance. Worse than this, when they get injured, sometimes severely injured, that what the Israeli employers do is that they just force them to leave the settlement and go seek a cure at Palestinian health centers. Regarding the illegal workers, they are totally denied any health insurance, and they suffer due to that. I mean, a few years ago, a Palestinian worker, he was illegal worker. He got injured. The Israeli employer refused to take him to an Israeli hospital, and on the way to a Palestinian hospital, he passed away. And the spread of the pandemic only has made the situation get worse. I mean, at the beginning, we've seen, like on social media, pictures of Palestinian workers. They were dumped at the other side of the checkpoint or the other side of the wall when they were suspected of having COVID-19, instead of taking them to hospitals and treating them. The situation also has got worse for Palestinians who work in agricultural settlements in the Jordan Valley, where most of the Palestinians there work, because their Palestinians don't have health insurance and they get underpaid. So they cannot really get decent treatment by paying for that. And on top of that, when they get back home, I mean, they work with chemicals in these agricultural settlements. When they get back home, they don't find water or enough water or clean water to wash their hands after a long day of work. And I mean, they lack all the basics of sanitation because they lack water, and that's due to the fact that Israel practices water apartheid against thousands of Palestinians in the Jordan Valley as a measure to ethnically cleanse them from their lands. I mean, these people, they are just thankful that they have roofs on their heads, and they thank God that their homes have not yet demolished. The last thing that I wanted to mention is regarding the vaccination of Palestinian workers. I mean, Israeli employers pressure the Israeli government to vaccinate the 100,000 Palestinian workers because they wanted to make sure that their economy is ongoing and they make profit, but they refused to take any Palestinian workers to hospital if they get any side effects right after they get the vaccine. So Palestinian ambulances used to wait at the checkpoints if any worker needs any help or to be treated in the hospital. So even they rejected that to treat them in Israeli hospitals. Thank you very much.
Thank you very much, Manal. That was extremely enlightening, and we appreciate you dialing in and joining us today. I'm going to go ahead and move us to our next speaker. Next, we have Farah Khadr. Farah is a public health analyst in New York. Her work involves the evaluation of COVID-19 disparities and vaccine distribution in Westchester County. Farah, thank you for joining us. Welcome, the floor is yours. I think you're on mute, Farah. No worries, it happens, it happens.
It happens a lot. All right, thank you. So in the interest of advocacy, what I thought I would do is pull some of the public health frameworks and key language being employed by US health agencies and then apply them to Palestinians living under the occupation. So it's well established in the US that communities of color, particularly Black Americans, have much higher rates of comorbidities that exacerbate their risk of severe illness or death from the coronavirus. So this is a function of racism, not of race. The US Department of Health and Human Services has acknowledged Healthy People 2030. This decennial program of goals is incredibly important to public health because it helps drive decision-making at the federal, state, and local levels. The core objectives have dictated program eligibility for billions of dollars of federal funding. So this consideration of the link between racism and poor health is echoed also in the Biden administration's plan to beat COVID-19, which establishes a racial and ethnic health disparities task force. So bearing in mind the idea that racism is a contributor to adverse health outcomes, we must note that Palestinians in the occupied territories and in Israel show significantly higher non-communicable disease rates, higher infant mortality, and lower life expectancy compared to Jewish Israelis. And compounding these rates is, as was mentioned before, inadequate preventive and urgent care and a healthcare infrastructure that's being destroyed systematically by military force. These facts have been long known before the current pandemic. But the risk posed by comorbidities are only part of the problem. So you look further upstream and you see oppressed groups are also the most likely to be exposed to COVID-19 in the first place. Healthy People 2030, in fact, emphasizes the social conditions that put people of color in these vulnerable positions. And this includes housing discrimination, legal segregation, which means that even in the US, still today, largely Black neighborhoods, tribal lands, and other communities of color have less available healthcare services, more crowding, more policing, reduced water quality when compared to predominantly white neighborhoods. So the parallels with Palestine here are very clear. Israel has complete control over the movement and well-being of Palestinians. Some relevant examples have already been mentioned, so I'll be quick. There's strict water rationing in Gaza and the West Bank to prevent sanitation. They make arbitrary arrests to put Palestinians in prisons and prison conditions. Home demolitions are a well-known tactic to drive Palestinians from their homes, and then the resulting crowded conditions and homelessness pose clear obstacles to following social distancing guidelines. While the CDC here ordered emergency eviction moratoriums in the States, Israel did not cease demolishing homes and health facilities during the pandemic. So there was no surprise from anyone monitoring global health disparities that COVID would be detrimental for the oppressed, and the most privileged in society would then be more quickly and easily vaccinated. So when we look at preliminary data from the US, we see that Black and Hispanic and Latino Americans' shares of the total vaccinations since December are less than their shares of the total US population. And a number of factors are at play here. One is access, meaning there was virtually no effort from the local and state health authorities to make vaccine registration equitable for all. Another issue is the mistrust of these authorities who have failed to protect communities of color from the coronavirus in the first place. So this is probably why National Minority Health Month, which begins tomorrow, it's April of every year, it has a 21 theme of vaccine ready. This is a National Institutes of Health effort to promote vaccines among communities of color. And the campaign's language of equity and empowerment has never been more prominent in the public lexicon as it is now, when the burden of disease so quickly and impactfully crosses racial and ethnic lines. And yet the US is complicit when the Israeli government's neglect of Palestinians and its robust vaccination program and their continued blocking of vaccine shipments to the region. Israel and Palestine are not separate. So what we are seeing is a literal division by ethnicity, which again should not have been a surprise, because despite violating international human rights laws, these are the kinds of behaviors that the international community accepts and expects from the Israeli government. So just to wrap up, if all that isn't compelling enough, the fact that this behavior literally puts the rest of the world at risk should be. Goal 5 of the vaccine plan, the National Vaccine Plan of 2010, is global prevention of death and disease through increased vaccination. This is a federal document, and this document and the US Department of State have pledged support for the Global Alliance for Vaccines and Immunization to protect the world from disease of public health importance. Likewise, the National Academies of Science last year published a consensus study report called Framework for Equitable Allocation of COVID-19 Vaccination. This dedicates an entire chapter of inequitable global vaccination and vaccine nationalism. So I'll end with a quote from this chapter. Global solidarity in ensuring rapid success to and deployment of vaccines is not just the right approach, it is also the best strategic approach for interrupting the pandemic. If successful vaccines are not equitably shared with low and middle income countries, we will continue to see differential morbidity, mortality, as well as economic and social shocks that will further increase global inequities, and with them global instability, displacement, large-scale vaccination, and ultimately insecurity. Thank you.
Thank you, Farah. Thank you. We're going to be transitioning over to Omar.
Hello. Thank you to everyone for joining us here today to talk about what it means to end medical apartheid from the US to Palestine. My name is Omar Zaza, and I'm the Education and Advocacy Coordinator for Eyewitness Palestine. I'm now happy to share how all of you watching can take action to bring attention to these glaring issues and to do your part to end medical apartheid wherever it appears. We in the Invest in Justice Coalition have put together an open sign-on letter directed at Dr. Anthony Fauci, calling on him to do 3 concrete things. Number 1, demand the right to healthcare for the Palestinian people and affirm Israel's obligation to provide them with COVID-19 vaccines. Number 2, refuse complicity with Israel's oppression of the Palestinian people and reject the Dan David Prize, an Israeli prize that is a long-standing boycott target for its whitewashing, we might even say culture washing, of Israeli apartheid against Palestinians, including medical apartheid today. And number 3, to advocate for racially just health policies in the US and everywhere, including the Movement for Black Lives COVID-19 platform. As you've been hearing today, COVID-19 did not invent systematic injustice, but it has exposed and sharpened injustices already there. Israel's refusal to vaccinate Palestinians is but the latest cruel and inhuman chapter of its decades-long practice of colonialism, ethnic cleansing, military occupation, and of course, apartheid against the Palestinian people. Israel providing Palestinians with COVID-19 vaccines is not charity, but a matter of what it is obligated to do as the occupying power and the main direct driver of Palestinian dispossession for over 70 years. Relatedly, in the US, which is not only Israel's main financial backer, but itself a settler colony with centuries of systematic racism to its name, both the tolls of COVID-19 and rates of vaccine denial remain systematically centered around indigenous Black and brown people. There is a name for this, and it's medical apartheid. As the Invest in Justice Coalition, we believe that justice is political. It's time to take a stand to end all military funding to an apartheid regime overseas and demand the end to apartheid right here. Please join us today by signing this letter by April 11th and spreading it to 4 key demographics. US-focused organizations whose mission and main political demands include Medicare for all and/or anti-racism and public health, global healthcare justice organizations, Palestine solidarity and liberation organizations, and individual experts on anti-racism and/or public health. Justice is political. From the US to Palestine, it's time to end medical apartheid.
Thank you, Omar. Omar, did you want to go ahead and introduce our next speaker?
Yes, thank you. So our next speaker is going to be Malak Zakut from We Are Not Numbers, who's going to be sharing out a written piece about medical apartheid.
Hello, I'm very happy that you had me here today. So I'm going to build up on what Manal and Farah have already said, because I think it's my duty towards not only my dad, but also every other Palestinian patient who passed away because of the medical apartheid. People in Gaza with critical medical conditions are not only threatened by their conditions, but also have higher likability to catch COVID-19 due to their weakened immune systems. The medical apartheid makes it even worse by reducing the number of vaccines coming to Gaza. Furthermore, patients who are being treated outside Gaza, especially in Jerusalem and West Bank, had to wait in lines to be okayed to go outside, which affects their health catastrophically. Unfortunately, some of them even die before being allowed. Amidst a season where colorful blossoms should turn into beautiful fruits, I woke up even before the alarm, haunted by a nightmare, a familiar one that had hovered around my head many a time before. Since my father has had cancer, every morning I felt paralyzed for only God knows how long. In my nightmare, the telephone rang. It was my brother, crying in horror, telling me that the cancer ate my father out to the last breath, that my father passed away. Freaked out by the horrible nightmare, my racing heartbeats woke me up. Then the telephone rang, and it was my brother. I was panic-stricken and immediately turned pale. I froze for a second or two, held the phone with trembling hands, and managed to answer. The word marhaba felt impossible at that moment. Surprisingly enough, my brother delivered me the most energetic good morning ever, followed by, "Father woke up from his coma, and the first word he said was your name. He wants to see you, Malak." I could feel the thud of my heartbeats. It was very unusual, even heart aching. The extreme amount of happiness rushing into my heart was like pouring cold water over a boiling rusty pot. My dad has always been a superhero. He fought 4 cancer demons. It took him 8 years, 15 kilograms, and a great deal of perseverance to beat three demons. Along these 8 years of agony, his condition was so critical many times. He even went more than 6 times a year to Jerusalem for treatment. It would take 2 weeks to a month. He survived though. At the time, when we thought life was treating us fairly, the 4th demon popped up and clouded over our hopes. An unwelcome guest that comes very late when you think it's the perfect time for you to rest after an exhausting day full of unwelcome guests. It's just so unfair to kick a wrestler in the back while he's taking a break after 3 fierce fatal fights. I was only 10 feet apart from my dad when nurses and doctors asked me to wait out. They were whispering. I felt a conspiracy was going around. Doctors, nurses, and even my family was involved. I could read full heartbreaking sentences in their eyes. They were eye communicating, and I couldn't do a thing but turn into a rock. I didn't have the guts to ask what was going on. And then I saw 4 hands over my dad's hospital bed blanket. They were moving my dad elsewhere. It's been 2 years now. I still wake up every morning and check his room. I still help mom preparing the table for lunch, and mistakenly sit 6 chairs, 6 spoons, 6 forks, and 6 cups. Number 5 is never my number and will never be. I still believe Dad is here with all my being. I'm not a doctor, yet I know how life is cut off here. Diagnosis, treatment method, civil coordination, and several weeks of waiting to have your name okayed to resume treatment outside Gaza. I mean, if you're lucky enough and haven't died already, because in my dad's case, a week after the funeral, the approval message was received over my dad's phone, a message that ridiculed our pain. Like, hello, the person you're trying to reach is in heavens now. Please try again with another patient before it's too late. My dad was the kind of doctor who helps patients dedicatedly. His patients would come over to our house at midnight from all areas of Gaza. My sweet dad never ever complained about it. Although I was secretly getting a little mad that my dad was not getting a good sleep after a tiring day of work at the hospital. You know what hurts the most? My dad was a doctor who did all his research papers on cancer, yet died of cancer. I sometimes console myself that my sweet dad was too good for this world. He is. It's not the case that a girl has lost her dad. It's the case that Gaza and even Palestine have lost a great doctor. Amidst a season where colorful blossoms are supposed to turn into beautiful fruits, I lost my dad.
Wow, wow, wow. Thank you so much, Malak. Allah yarhamo. That was beautiful. Thank you. Thank you for showing us a very emotional and deep part of yourself. We appreciate you sharing with us. I can tell people are stuck to their screens and everyone is really moved. So thank you again so much, Malak. Thank you for joining us. I'm going to transition us, albeit difficultly, to our next speaker, Dr. Sahar Al-Sulaibi. Dr. Sahar is a medical doctor who works in Hebron with the Palestinian Medical Relief Society, a grassroots community-based Palestinian health organization. Dr. Sahar, my family is also from Al Khalil, so it's really wonderful to have you here. The floor is yours. Thank you for joining us.
Thank you so much for having me. I'm sorry, but I'm struggling with my internet connection, so I'll keep it only audio for now. Is it a big problem?
I think we can work with that. Thank you, Dr. Sahar.
Okay, thank you. I'm a women's health doctor working in a mobile clinic that offers free medical services to Palestinians in the remote areas of the West Bank. In the occupied Palestinian territory, we deal with isolated, vulnerable groups and displaced populations. As for many of them, we are their only source of healthcare. Usually I leave my house at 7 in the morning to join my colleagues and head toward a new destination for the day. It's often a few hours drive, not just because of the remoteness. Over 100 fixed and over 2,000 flying Israeli checkpoints hamper Palestinians' free movement within the West Bank, including us as a mobile clinic. I don't want to forget to mention that a checkpoint might be closed without any prior notice, and we have no other option but to come back. Add to all of this COVID-19 pandemic, which is just making things harder and harder for us. For example, like many of the communities we're working with are not even aware of COVID-19, and the virus still carries a big stigma. And with this lockdown, I'm not even able to find a taxi early in the morning to reach my colleagues in the first place. This COVID-19 pandemic has profoundly impacted our public health as well as economic and social life. These effects have been compounded by the ongoing reality of Israeli colonialism and occupation, economic subjugation, and home demolitions. I want to mention Zanuta, which is a small community that we provide our service, where we provide our service. 7 of their tents were demolished by the Israeli military the past week. And actually, the caravan where we work is also under threat. I think that our health system is suffering, and we are facing a number of difficulties in launching our own vaccine campaign, including a shortage of money, lack of infrastructure, and distribute vaccines. For example, me as a doctor working in the front line 6 days a week, nonstop since the beginning of this pandemic, and still not being able to have my vaccine or to get vaccinated. I think that Israel actually is violating international law because it's denying its responsibility as an occupying power. They are receiving vaccines, and us as Palestinians, we're getting absolutely nothing, even like the really sick ones. And the effect of this pandemic is not, I think, not that it's not felt equally for as many, like including health workers, construction workers, who must travel to their jobs. And as you mentioned before, many of our construction workers are like working in areas under Israeli control. Palestinian women and youth have been the hardest hit. Women workers also shoulder more of the burden of unpaid care work, including childcare and homeschooling. I can only relate the lack of chronic medications that we face, the number of malnourished and anemic babies in this like poor socioeconomic status. In the end, like a firm believer in what we do, and every time we help a man in need, I know it's worth the effort. Thank you so much.
Thank you, Dr. Sahar. Once again, really wonderful to hear someone from Al Khalil, from Hebron, to talk about the difficulties that our people experience in those territories. I'm going to transition us next to our very special message from our very own Congresswoman Rashida Tlaib. So can we cue up that video, please?
Everyone, I'm Congresswoman Rashida Tlaib. Thank you so much to Invest in Justice Coalition for inviting me to speak with all of you today. I am deeply appreciative and so grateful for the organizing you all are doing to bring up the critical issue of medical apartheid in Israel and in Palestine today. The COVID pandemic has reinforced what many of us already knew about the Israeli occupation, that it threatens the lives and the well-being of Palestinians, not only through military violence, but also by denying access to adequate health care. As the Israeli government currently is celebrating its high vaccination rate, human rights advocates right now on the ground noted that Palestinians living under occupation continue to be excluded from receiving those vaccines. Now, Israel recently announced they will be vaccinating Palestinians, but only if they work in Israel and within the settlements of the West Bank. But let us be very clear, under international law, Israel is responsible for providing vaccinations to all Palestinians living under its occupation, not just those that contribute to Israel's economy. It is not just the lack of COVID vaccinations for Palestinians that is an issue. This is only one facet of a larger issue, which is medical apartheid, a system that delays and stops Palestinians like my grandmother from traveling through military checkpoints to access healthcare, a system that blocks Palestinians in Gaza from leaving to seek specialized treatment they can only find elsewhere. I am proud of the congressional letters that many of my colleagues and I recently sent to the Biden administration that urge them to put pressure on Israel to comply with international human rights laws and respect Palestinians who deserve to live with human dignity, especially in regards to vaccinations, annexation, and so much more. As progressives and advocates for social justice, we all know and need to continue to raise awareness of how the systems that oppress Palestinians in Israel and the occupied Palestine are mirrored here in the United States, where racism in our healthcare system means that Indigenous and Black Americans die at a more higher rate, twice in many cases, of our white counterparts. Just as systems that oppress us are interconnected, our struggles for freedom and equality must be as well. When I see the United States, our country, sending nearly $4 billion in military aid to Israel, I not only see money to support occupation, but our tax dollars that could be used to fund healthcare here at home in our districts. One of the poorest districts in the nation is mine, the 13th Congressional District. This is just one example of the need to stop investing in war and start investing in healthcare. So please know I won't stop fighting until that happens, and I know neither will all of you. So thank you again for your invitation today and all of your incredibly hard work that your organizations do every single day. Take care, please be safe. Salams.
I hope you all enjoyed that very special message. I have the honor of attempting to follow up Congresswoman Rashida Tlaib, and we'll do my best. I hope you all have enjoyed the time we've had here. I want to leave us on a high note before we get to our action item. You know, Congresswoman Rashida Tlaib is a part of the new political reality we're witnessing here in the United States. No longer is the Palestinian movement siloed to the side and unwelcome in the halls of Congress. Yes, we have a lot of work to do. We have a lot of advocacy to be conducted, and hopefully we'll get to some of that in a minute. But we do have a new reality here at play, a reality that should cause each of us to dig deep down and consider how we can contribute to the future that we want to see. A reality that should cause us to dream big and envision hope and justice and freedom touching our peoples and communities that for far too long have been kept away from such ideals. So Rashida Tlaib is not, while she's the only Palestinian American in Congress, she's not the only voice for Palestine. We have, as we mentioned earlier, 20 members of Congress taking action to end medical apartheid in Palestine, but more will take action if we do our jobs. So I want to thank all of our speakers who joined us today for allowing us to better understand the realities on the ground, for allowing us to better understand the dynamics at play, including those impacted by vaccine apartheid. We're going to transition now to my dear colleague, Beth, to lead us in an action, and I hope you all will join us because this is where it counts. When we're motivated, when we're inspired, when we're passionate, and we communicate that message to the halls of power. So thank you all for joining us. I'm going to hand it over to Beth, and we're going to try to make some action happen.